The anterior approach, essentially, the major difference is we're not cutting any of those muscles around your hip. And so I'm just going to show you the kind of interval that we use just to orient you. This is the hip socket. This is your hip ball. This is your femoral nerve, and these are some of your major vessels around the hip. So the major advantage is we don't have to cut any of the muscles around the front part of the hip, and we're able to use this natural interval to get in to replace the hip. And so the major advantages, again, is because we're not cutting any muscles, we're not challenging your hip to recover from those muscles being cut. Another major advantage that we've noticed from the anterior approach as compared to a posterior approach or anterolateral approach is going to be that you don't have these hip precautions. And then also there's a decreased dislocation rate. All that means is sometimes when hip replacements are done, the ball may actually pop out of the socket. If the ball pops out of the socket, certainly that can cause you pain, and you have to a lot of times come to the emergency room. That ball has to be put back into place. And so with the anterior approach, if you see these rates, the dislocation's less than 1%, as compared to posterior approaches as high as 3 to 5%.